Hello everyone, in this video we are going to take a look at the cervical plexus. Now when you dissect the anterior and posterior triangles and you go through the skin, platysma and the subcutaneous tissues superficial to the investing layer of the deep cervical fascia, you will come across these cutaneous nerves that you can see here. The lesser occipital, great auricular, transverse cervical cutaneous and the supraclavicular. Now all of these are arising from the cervical plexus. Now this cervical plexus is formed deep in the paravertebral region by the side of the cervical spine between the scalenus anterior and the scalenus medius, and they give out all sorts of branches. They give cutaneous branches, motor branches to muscles, and they also contain sympathetic nerve fibers. And let us see how the plexus is actually formed. Here we have an outline of the formation of the cervical plexus from C1, C2, C3, C4. That is the first four cervical nerves, all the ventral rami of these four cervical nerves. And you can make out that it's a looped plexus. That is, between the C1 and C2 there is a loop which has some sort of a ventral convexity, although it's not apparent here. Between C2 and C3 you have this loop over here, and between C3 and C4 again you have a loop, so it's a looped plexus. And by looking at C4 you can see that it contributes to the cervical plexus above and to the brachial plexus below. Similarly, you know that you have a division at L4 contributing both to the lumbar and sacral plexuses, and you have such a splitting at S4 contributing both to the sacral and coccygeal plexuses. Now if you look at the formation of these plexus, now these double line branches are all cutaneous branches, while the dark black branches shown here, they are actually motor for skeletal muscles. Now if we look at these branches, let us see from C2, the first branch you have here is the lesser occipital nerve going upward behind the auricle and supplying the cranial part of the auricle and going up to supply the scalp. Here you can see this lesser occipital nerve going up into the scalp and supplying the cranial surface of the auricle, and over here it actually winds around the spinal accessory nerve at this point somewhere here, actually behind the posterior border of the sternocleidomastoid. Round about its middle there is a nodal point from which you can find all these cutaneous branches diverging over the anterior and posterior triangle. So you should be very careful when you dissect out this region. This is where you are going to begin to look for all these cutaneous branches. So lesser occipital from C2, then we go on to the great auricular C2, C3. Now this great auricular nerve goes on to the auricle, supplying both the cranial as well as the lateral surfaces. The patch of skin around the angle of the mandible which goes into the nerve supply of the face, and then going up to supply the scalp as well. So here you can see the great auricular nerve here from C2, C3. And again from the same C2, C3 you have this transverse cervical cutaneous nerve going over across the sternocleidomastoid into the anterior triangle. Here you can see the transverse cervical cutaneous giving an upper and lower branch and supplying the lateral side of the anterior part of the neck from the lower border of the body of the mandible right up to the suprasternal notch. So this entire area is supplied by the transverse cervical cutaneous nerve, and below that coming down, these are the supraclavicular nerves from C3, C4. We have a lateral, intermediate and a medial branch. The medial branch supplying in addition the sternoclavicular joint. The intermediate branch may occasionally pierce the clavicle, and the lateral supraclavicular nerve supplying the upper and posterior parts of the skin over the shoulder. And these nerves actually supply the front of the pectoral region also, roughly up to the level of the second rib. So here again let us take a look at the supraclavicular nerves. These are quite prominent nerves from C3, C4, lateral, intermediate and medial. And now that you have gone through all these cutaneous branches, let us take a look at some of the other branches. For instance, here from C1 you can see branch to rectus capitis anterior and lateralis, and branch to longus capitalis, the prevertebral muscles, rectus capitis anterior, rectus capitis lateralis, longus colli, longus capitis, and the scalene group of muscles, of which you have rectus capitis anterior, lateralis, and longus capitis from C1. Not only that, you can make out that this C1 gives a communicating branch to the vagus. In fact, this communicating branch to vagus goes up and supplies a part of the dura mater as well. So the meningeal branch of the vagus that goes up into the skull is also derived from C1. And again, this C1 you can make out gives fibers which accompany the hypoglossal nerve and pass with the hypoglossal nerve and later diverge from the hypoglossal nerve to supply the geniohyoid and thyrohyoid. These two muscles, they are supplied by C1 fibers accompanying the hypoglossal nerve. And not only that, the meningeal fibers, the meningeal branches of the hypoglossal nerve are also derived from the C1 fibers, which are piggybacking on the hypoglossal nerve. And again, you can see that the C1 fibers further diverge from the hypoglossal nerve and come down to form the superior root of the ansa cervicalis, which is also called the descendens hypoglossae. And it is completed by a loop formed by descending branches from C to C3, which is called the descendens cervicalis, and the loop itself is the ansa cervicalis. Now this loop and these fibers of C1, C2 and C3 are meant for supplying the infrahyoid muscles. So this descendens hypoglossae supplies the superior belly of the omohyoid, and the ansa proper supplies the inferior belly of the omohyoid, sternohyoid and sternothyroid, and these is the loop, and this loop actually in the between the anterior and posterior triangles really, but actually dissected in the anterior triangle. When you open up the anterior triangle and the carotid sheath and you dissect over the internal jugular vein, you can actually see the ansa cervicalis here. You see over the internal jugular vein, this here is the ansa cervicalis. You can see the loop and it is stuck onto the carotid sheath. So if you remove the carotid sheath from over the internal jugular vein carelessly, you can actually disrupt the ansa by your dissection. So this is the ansa cervicalis. It is also a part of the cervical plexus. Not only that, from C2, C3 and C3 and C4, there are nerves going into the posterior triangle which supply also the sternocleidomastoid and the trapezius. According to some authors, they are motor fibers. According to some authors, they are proprioceptive fibers. But these fibers from C2, C3 and C4, they accompany the spinal accessory nerve across the posterior triangle and they supply the sternocleidomastoid and the trapezius. Apart from that, of the scalene group of muscle, the cervical plexus supplies the scalenus medius and the scalenus posterior as well, and the longus colli. And what is most important is that from C3, C4 and C5 you have the very important phrenic nerve descending down into the thorax, supplying part of the mediastinal pleura, the diaphragmatic pleura, the diaphragm, the subdiaphragmatic peritoneum and the pericardium as well. So this phrenic nerve is a very important part of the cervical plexus which should not be forgotten in the discussion of so many nerves. Now if you look at this picture, you can make out the areas of the nerve supply. You can see the great auricular nerve here, angle of the mandible, and the pinna and the lesser occipital, again pinna going up into the scalp, the transverse cervical cutaneous for the front of the neck, and the supraclavicular nerve, upper pectoral region and the clavicular region. So this I think will complete our discussion of the cervical plexus. I think this is sufficient for your exams. Thank you.